On behalf of the Surrey Fire Service, thank you for this opportunity to share some of Surrey Fire Service's initiatives made possible for harnessing the power of data for good. The Surrey Fire Service, which serves a rapidly growing city of just over 500,000 people near Vancouver, uses an evidence-based approach to develop a response to the rising incidence of fire and the opioid crisis. Nearly a decade ago, the Surrey Fire Service adopted an evidence-based approach to its business practices. We adopted the elements of evidence-based decision-making now referenced in the guides, the right decision, evidence-based decision-making for government sector professionals. These core elements are defining the problem, identifying what data is needed, gathering the information, analyzing the results, applying them to a decision, and evaluating the outcomes. Surrey Fire Services in 2007 commissioned the University of the Fraser Valley, Dr. Amanda V. McCormick, to conduct a retrospective study of nearly 5,000 fires over 20 years that occurred in Surrey. The HomeSafe program was conceived to leverage local fire and demographic census data with fire hotspots in the community to target door-to-door firefighter visits and smoke alarm giveaways. This review identified that 75% of fires occurred at residential properties. It was further discovered that only 30% of these fires involved a smoke alarm that was working. The study also revealed that functioning smoke alarms save lives. Fire risk is associated with high-risk people, properties, and places, and that fire prevention home visits and education make a difference. The response? HomeSafe was launched in October 2008. It was further discovered that in spite of more smoke alarms being present, they function less often. Smoke alarms are a primary prevention of fire-related casualties. Risk is reduced by 49% when a working smoke alarm is present. Social data linked from Canadian census tracts in Surrey identified the locations of the top 10% of the at-risk population comprised of persons older than 65 years of age, household members under the age of 6, single parents, unemployed persons, transient occupants, and locations with previous occurrences of fire. This social data was layered and combined, creating linkages that defined target areas. This enabled us to focus our education and prevention activities to the greatest effect. Contacts made by Surrey Fire Services to each residence as part of HomeSafe inspections utilize key indicators across the city demographics. We focused our resources on providing support to seniors and other at-risk residents to target fire risks. The results were 104% increase in working smoke alarms, 63% decrease in fire rate, and 75,000 contacts made. After 75,000 interventions, the occurrence of residential fires plummeted. The incidence of residential fire casualties has dropped by half. In 2014, the results of the treatment seemed to diminish, so we reassessed the social data linkages and retreated the population. There's still room for improvement to increase smoke alarm coverage. Smoke alarms are fundamental to ensuring ongoing reductions in fire-related fatalities. Use of data-driven, targeted interventions can manage risk for individuals, communities, and cities. What if all Canadian fire services adopted this approach? Opioid overdoses and deaths were declared a public health emergency in BC in 2016. BC is Canada's opioid overdose and death hotspot, and Surrey is second only to Vancouver in the province. Overdoses occur in all Surrey neighborhoods and dwelling types. The opioid crisis has affected every part of the country. According to available data reported as of June 2018, there were 3,987 apparent opioid-related deaths in 2017. Surrey mobilized in late 2016 due to a lack of effective interventions and a spike in overdoses. Efforts included Surrey Fire Service Real-Time Business Intelligence Tool, Surrey Community Action Team, SafePoint, and Quibble Creek Safe Consumption Sites. The Surrey Opioid Data Collection and Community Response Pilot Project brings together the City of Surrey, Fraser Health Authority, and Statistics Canada, and involves unprecedented information sharing. The demonstration project will use data to develop evidence-informed interventions, precision programming, and policy development. It can be considered a model for the rest of BC and Canada with funding and resource support from provincial and federal governments. Preliminary data for this project was released November 13, 2018. More opioid project findings will be released in early 2019, providing more in-depth analysis. Data will include medical services plan history from general practitioners and specialists, prescription medication history, mental health services, and will encompass both fatalities and survivors. Machine learning is being applied to other aspects to help form new interventions. The first social data linkages found. 66% of those who died had no contact with police. Construction and building maintenance workers dominated the employment sector, and 40% never received social assistance. Insights gained from Surrey data collection and analysis, the Opioid Project, and other sources over time will assist in the development of evidence-based policy and programming that, for the first time, will help address the root causes of the opioid crisis. Economic Insights and Jurastat reports. 2 reports containing more in-depth analysis in the area of employment, social assistance, and contact with the justice system will examine intersections with the other domains. Health Report. Moving beyond fatal overdoses, this report will be a comprehensive look at the trajectories of both the fatal and non-fatal overdoses, looking not only across the other social domains, but will also incorporate prescription history, mental health services, and medical services plan data where available. Acquisition of additional data. The project will identify and engage with providers and stakeholders to acquire additional data to help inform the crisis. For example, district school boards, Indigenous indicators, and additional social assistance data. Data to action. Through the project, StatsCan will support in various capacities Surrey's Spring 2019 Forum aimed at operationalizing findings from the Surrey project to develop precision programs and policy development.